And then there's also another mindfulness exercise that I taught Maria early on, and that is the safe place exercise. So, one of the ways of doing mindfulness is simply through imagery or guided visualization. So, the safe place exercise, well known exercise, it's all about helping a client identify a specific scene or scenery that is just inherently peaceful, relaxing, that feels safe and secure. So, in Maria's case, she mentioned right away that she loves the beach. And so, once a client has identified a specific scene that is calming, that's relaxing for them, you then want to walk them through the five senses. As you imagine yourself at the beach, what do you see? What do you hear? What do you smell, taste, and touch? So when I asked those questions to Maria, when I asked her, what do you see as you imagine yourself at the beach right now? She said the water and the waves, kids playing in the sand. Well, that's great. So what do you hear? Well, I hear the waves, right? The sound of the waves coming and going. I hear the seagulls. I hear children laughing. Is there anything that you smell at the beach? Is there any aroma, fragrance? She said, yep, I smell the seawater. I smell just that distinct kind of smell of how the ocean smells. And I asked, is there anything you taste? And she said, no. And that's fine. It's not like all of the five senses have to be included in this exercise, but it is a good idea to run through all the five senses just to make sure they're all potentially covered. And then I asked her, is there anything you feel physically with the sense of touch? And she said, yep, I feel the sun rays on my skin and I feel sand on my feet. So once you've covered the five senses, the next thing you want to do is ask the client, so what do you feel emotionally as you imagine yourself in this particular location? And Maria said, I feel a sense of just peacefulness. And that's great if they can summarize their emotional experience in just a word or a couple of words. So in this case, that was pretty easy for Maria to do. And then there's one other step here. You don't want to forget this. So I asked Maria, oh, it's wonderful that you feel this sense of peace. And I'm just curious, where physically in your body do you feel that? And she said, in my chest. And that's really important that you can help a client, if possible, it's not always possible, but when possible, to help them identify a specific location in their body where they feel that sense of peacefulness or that sense of whatever it is. And the reason that's so important is because now the client can locate that safe place somewhere in their physical body. So where is Maria's safe place? Is it at the beach? Well, that's one safe place, but really it's right in her chest, right? That's a resource she can take with her, whether she's at the beach or not. So she might have to imagine being at the beach in order to get to her safe place, but the safe place is actually within her, right? And that's kind of the goal of this exercise. There's another imagery exercise I wanted to make sure Maria learned, especially since I was anticipating doing some kind of trauma work with her. So I wanted to teach her the container exercise too. Now, the container exercise is a great exercise you want to do with your trauma survivors because it's all about how to contain trauma memories that are too overwhelming, or if there's so many trauma memories that are just coming up, but you can only obviously process one at a time. How can you contain the other trauma memories so you can just focus on just one at a time? That's when you do the container exercise. And there's different ways of doing this. So typically you have a client imagine some kind of box or vault or safe or trunk, some kind of physical container, or it can be an electronic or virtual container too. But the idea is only the client knows about this, and only the client has the key or the password or the combination to access and secure this container. So in Maria's case, the container she came up with was a little bit unique, but I rolled with it because I thought it was beautiful. The container she came up with was a secret well in the middle of a field of flowers. So nobody else knew about this well, only she did. And she said, even as a child, she would imagine just hiding in that well. So I said, perfect. That will be your container. So anytime something comes up that's just too triggering for you, just imagine putting that in your well in the middle of the field of flowers. Okay, so as Maria was learning all of these different mindfulness exercises, I also wanted to teach her some mindfulness reflections. So in other words, how to reflect back on your mindfulness experience and basically see what you're learning from it. So I asked Maria, of all the different mindfulness exercises that you've been practicing, is there any of those that you would like to focus on more just to reflect on? And she said, yep, the pickup soccer games that we've been playing. So I said, perfect, that'll work. Let's go with that. So I walked her through 4 follow-up questions. The first question is, what did you notice when you were mindful? So in this case, when you were mindfully playing soccer, she said, well, I was able to concentrate better and even score more goals. So I said, oh, that's wonderful. Is there anything else that you noticed as you were mindfully playing soccer? She said, well, yeah, I also noticed that I was sweating a lot. I was out of breath a lot. My heart was beating faster. And I also noticed a mild leg cramp. So then the next follow-up question is, so what was different about this experience? So in other words, what was different playing soccer mindfully versus how you normally play soccer? And she said, well, I don't usually pay attention to those things, referring to some of those symptoms, so to speak, of sweating or getting out of breath or heart beating fast or that mild leg cramp. So, okay, that's really good information that you noticed those things as you were playing soccer. The third follow-up question I asked was, so how does what you learn relate to your clinical symptoms? Her anxiety, her depression, her panic, her PTSD, those sort of things. And her response was absolutely perfect, because what she said was, wow, so some of those things that I noticed when I'm playing soccer, like, for example, the sweating, the heart palpitations, shortness of breath, those are actually the same things I have when I have a panic attack. So I asked her, so, well, did you have a panic attack? And she said, no, of course not. I said, well, why not? You had all the symptoms of a panic attack, so why didn't you just have one? And she basically looked at me like, come on, don't be silly. Like, I was just playing soccer. Like, you're supposed to sweat. You're supposed to be out of breath when you're running around. Your heart is supposed to beat faster when you're exercising. I said, yeah, you're right. Your body is supposed to do all that. So, but why didn't you have a panic attack? And it dawned on her that she could have the symptoms of a panic attack without actually having a panic attack. Right? So she was learning lots of information just by this basic mindfulness work. And that's the whole point of mindfulness work. And then the last follow-up question I asked her was, so how does what you learned relate to your personal life goals? And her response was once again perfect. Doesn't always go according to script like this, but Maria was a great client to work with. And she said, well, if I can be more mindful playing soccer, then I can also be more mindful in other areas of my life too. And that's the whole point here. I mean, what's the point of helping a client be more mindful playing soccer? Like, who cares? Is that really a big deal? Well, yes, it is a big deal, because that's the arena, so to speak, in which she's learning these skills. Because it's a safe arena. It's an arena that she likes and enjoys doing. And then she can apply these skills to other arenas of her life too. So, for example, if she can learn that mindfulness helps her score more goals in soccer, then maybe she can also realize that mindfulness will also help her achieve other goals too. Okay, so those were all mindfulness skills. And once again, mindfulness is kind of foundational in DBT, because we use all of those mindfulness skills to then learn other skills. So as you're going to notice, there's lots of overlap in DBT, especially between mindfulness and distress tolerance.